Welcome to Vital 100 Wellness with Dr. Bob, the podcast designed to take your health to the next level.
Hello, Dr. Bob Johnson here with another podcast episode in Optimal Health with Dr. Bob. We're on a lot of very interesting topics, but this is a topic tonight that I think is going to tie a lot of pieces together, or at least answer some questions for so many of you. And the topic for tonight that I'm going to address and get it out to you people is what kind of healthcare approach is right for you. There are many approaches, not only within the United States, but also around the world. There's everything from Chinese medicine to Ayurvedic medicine to herbal medicine to homeopathic medicine to what is a dominant type of medicine, which is allopathic traditional medicine, also known as pharmaceutically based medicine. And so what I want to do is I want to lay it out to give you some choices by giving you some of the pluses and minuses of each of these and where they would best apply. And by that manner is allow you to be able to choose what's right for you and seek that out. Now, many people want to combine the different choices of healthcare approach, and that's fine. But I think it's important to understand what you're getting into and when to get into what type of healthcare you are wanting to choose. And what's important is that you make your own decision. It should not be decided by the most glamorous types of advertising. I notice on many of the broadcasts, whether the radio or whether TV, very pharmaceutically approached. For every problem, there is another drug, another way to take a pharmaceutical. So I want you to not just choose the type of healthcare for you. It should be customized to not only you, your approach, what's comfortable for you, what you actually need and want from a healthcare approach. And like I said, you may want to be able to pursue at different times a couple of different healthcare approaches. So I want to at least try to touch base on, if not all of these, several of these, and be able to go from there. So let's talk a little bit about the traditional pharmaceutical allopathic medical approach. Now, what the approach is, and this is what pharmaceuticals, which are a very, very strong lobbyist group, that they push all kinds of drugs for every single thing. Now, many times that may be the best approach, but many times what ends up happening is that you pick a drug based on what it said on a TV show, or they even say, go ask your doctor about X, Y, and Z drug. And the doctor, of course, is going to, for the most part, is going to say, yeah, that's fine. Let me see if I can write a prescription for that. What happens with a pharmaceutical approach to healthcare is that they want to identify exactly what your symptom is indicating, what disease, what dysfunction you're having, and then choose the drug, as I call it, the drug du jour, the drug of the day approach that's going to be called for in that disease or illness or dysfunction. There's a couple of problems with that. First of all, many drugs, let's step back a little bit. The approach is that a drug is going to solve the problem. A drug really is going to only treat a symptom. A lot of people think that a disease is actually, they think that the disease they have, but it's actually a symptom. So for example, blood pressure, high blood pressure or low blood pressure, that is a symptom of so many other problems that are going on. Many times cancer is a symptom. Yes, it can be classified as a disease, but it's a symptom of a bunch of other things that are going on. The next problem with the pharmaceutical-based approach is that a disease or an illness or a dysfunction can come from many different directions. What causes cancer, what causes diabetes, what causes neurodegenerative disease or cardiovascular disease, or any number of diseases actually can be the result of several different, what I call underlying issues. And so the only, instead of a pharmaceutical being the approach and the solution to your problem, the healer, the only true healer in your life is your own body. Your body has many, many vital capacities to be able to heal itself. The reason it becomes dysfunctional or diseased is that it has been exposed to a very toxic poison or a infection like a COVID or something of that nature, a virus, a bacteria. The other day, I got some food poisoning, and that's a salmonella toxin or a salmonella microbe that caused me to have a 24-hour illness. And so it's important to understand what is causing the illness, the disease, to manifest itself. And pharmaceutical approach doesn't do that. It doesn't figure out what the disease is or what it's caused by. What it does is it treats the symptom. And so even though you may have the symptoms disappear, if you don't treat the underlying issues, the disease will come back. So you've got to identify the diseases and approach it from that point of view. Give the body the tools to be able to heal itself. Give it the chemicals, or give it the immune enhancement, or detoxify it, or give it one of the brain chemicals that's needed, or help it reduce inflammation. So those are all very important to be able to help permanently resolve the disease or the illness. So, and the one other problem with the pharmaceutical approach is, and this is interesting because you'll see this on many of the commercials for medications, is the last half of the commercial is telling you all the side effects that are going to happen if you take their medication. You're going to you're going to consider suicide. You're going to have bleeding from the ear, nose, and mouth. You're going to have whatever it is. They'll spend half the commercial telling you in a low voice to minimize the extent. They're going to actually tell you what the problem and the side effects of those drugs are. So that is the problem. Occasionally, with a severe acute injury or illness, you might want to take a drug. If you certainly break your leg, you want an orthopedist to do his specialty or her specialty. If you have an acute other problem, yes, you want to do something. One of the solutions to acute problems in the allopathic traditional medicine genre is to give steroids to severely reduce inflammation. So in fact, those are the pluses and minuses of allopathic medicine. Now, Chinese medicine considers, and there's two parts of it. One is it considers the energetic flow in the body. If you don't treat and you don't diagnose the energy flow, your body is just not going to heal itself. We are anatomical beings. We have physical mass, but we also are energetic beings. That's shown all the time that we have energy flowing throughout our body. And what Chinese medicine does is it attempts to heal certain things by normalizing that energy flow, which has been disturbed by a toxin, an infection, severe stress, those kind of things. It doesn't treat everything. And the other part of Chinese medicine are herbs. Herbal medicine is a huge component of what we call TCM, traditional Chinese medicine. And if you look at the most followed type of medicine throughout the world, it probably is traditional Chinese medicine. Now, closely related is Ayurvedic medicine, pretty much the type of medicine that is in India and associated countries where they treat with natural herbs, they treat with natural substances to be able to get the body to heal itself. So very important to be able to understand that those are very good. They can be combined with traditional medicine or other natural medicines to give the best results. Incidentally, if you're looking for the right practitioner, a person who understands various forms of medicine and healthcare approach are probably the best, because instead of just following their one knowledgeable way that they approach healthcare, is that they can bring a little bit from this one, where it's appropriate, bring it this one, maybe add an herb, maybe know when they have to get you to a physician to prescribe a medication. That's the best kind of practitioner. They're very few and far between. I like to think of myself as someone who knows several forms of healthcare and can bring different ideas and different solutions to every problem. I seem to be getting some wonderful, wonderful results by combining different approaches. In the US, naturopathic medicine, and yes, this is followed throughout the world, is also supplements, vitamins, minerals, homeopathic substances, and I'll explain that in just a second, and energetic medicine combined to be able to really identify and locate where your problem is coming from, and then give you the tools so the body can start healing itself. As I said, the body is the main healer for each and every one of us. It's not to be overridden by some drug or something of that nature. Now, when you have some severe things, you have advanced Alzheimer's or severe cancer, yes, you have to look at some things like radiation, maybe surgery, those kinds of things. But so many of the combinations of different healthcare is right. What I personally do is I have assessment tools to really be able to localize and locate what are the main issues that are affecting people and for each individual person, and be able to prioritize those. So it may be that a toxin is the next one, the biggest problem. Lack of oxygen is the next one, and so forth. And it's important that I treat the top several issues and let the body start healing itself, and then reassess to see what comes out, and to continue to work with a person to be able to start treating the top issues so the body can start to get on top of them and start to heal itself. The body is amazing in its ability to heal itself. And so it's important to find out which healthcare system you are most comfortable with. Other forms are osteopathic medicine, where the structure is considered, where the cranial rhythm is part of that. Osteopathic medicine now is very much a part of traditional allopathic medicine, but it expands into some more natural approaches to get the body to heal. Other forms of, I was going to explain homeopathic medicine. Homeopathic medicine is very unique because what it does is it gives you very, very low doses, like microscopic doses of the problem you have. So for example, if you have a toxoplasmosis, that's a parasite given to us by cats and dogs. If you have a homeopathic series to give, you give a very, very low dose of that infecting microorganism in a liquid, and it starts to give the signal to the body and the immune system to start healing that parasite. And so that's the way homeopathic medicine works, is to give very low doses and decreasingly lower doses to fine-tune the immune system so it can get on top of itself and heal the problems that are present. So whatever you choose to do, a more natural approach, a more pharmaceutical approach, an energetic approach, which is very important. There's many energetic approaches where you normalize the energy flow in the body. There's certain ways to heal, like intravenous therapies with vitamins and minerals. There are so many ways to be able to heal. In fact, some of the upcoming ways to heal that are really starting to take hold. Stem cell therapy. Stem cell therapy is to give you our initial stem cells that the body uses to be able to heal and to be able to treat an area which is degenerating or falling apart. And so stem cells actually can turn into many different things. They can turn into skin, they can turn into liver cells, they can turn into heart cells or brain cells to be able to go where the body needs it to heal. There's new energetic treatments, like a new technology is called medbeds. Medbeds are energetic healers that literally are going to, shall we say, make many types of medicine obsolete. These are coming. They aren't quite here yet. Actually, some countries are using them, but just put that in the back of your memory. Medbeds, M-E-D-B-E-D-S. So as you can see, there are many approaches. And I think the most important thing is to do your research, to start talking to different practitioners, ask good questions of different types of practitioners, of people who are very not focused on getting you to a referred doctor or naturopath or whatever, nutritionist, but to give you the lowdown, the information on each of these, and you can do your research to find out what you feel most comfortable with. The good thing about more natural medicine, if things are not working, you're not going to have basically the side effects, and you can go and stop them and start something else. So before you have real emergencies, real major end-stage problems, before you have end-stage Alzheimer's and cancer and MS and cardiovascular disease, you really do need to do your homework, find the right network of practitioners that you can use in times of your need for these different problems. Find a nutritionist, find an acupuncturist, find a naturopath, find a doctor, a family med doctor who's not going to always prescribe the latest medications. Find someone who's going to not only listen to you, form a relationship with you, but that you trust and is very knowledgeable in several forms of healthcare that you can trust, and you can get better healing, not only in the short term or acute issue, but in the long term, and that you can trust that they're going to keep knowledgeable throughout their relationship with you. I hope this helps, and I want you always to remember that the important thing in life is to enjoy the journey. Thank you, and take care, and keep healthy.
Thank you for joining us on this episode of Vital 100 Wellness with Dr. Bob. Be sure to visit our website at vital100wellness.com for more ways to listen and to explore additional health resources. If you have any questions for Dr. Bob or feedback and suggestions for the podcast, you can email us at info@vital100wellness.com.